So last time we talked about features of a synovial joint, which included the articular cartilage, the joint cavity, the articular capsule or the joint capsule, the ligament, and the nerves and blood vessels. So now we'll continue talking about the synovial joints. Okay, so let's talk about factors influencing stability of synovial joints. So synovial joints, they're the weakest part of the skeleton because they are so mobile. Remember, synovial joints are diarthroses. So because they are mobile, they're actually the weakest part of the skeleton. And there are a few factors that stabilize the synovial joints. And the factors are basically listed here. The shapes of the articular surfaces, so where the bones meet, the shape of the surfaces themselves, they play a factor in stability of the joint. The number and positioning of the ligaments, and the muscle tone. Okay, so first let's talk about the shapes of the articular surfaces. They determine what movement is possible at the joint. They play a minor role in stability, so they're not an important factor, but it's still a factor. And the hip joint is the best example of a joint made extremely stable by the shape of its articular surface. So the hip joint is a ball in a socket joint. So here's the head of the femur. So this is the ball, and then the acetabulum right here is the socket. So we call this a ball in a socket joint. And this is an example where the joint is extremely stable because of the shapes of the articular surfaces. Okay, the second factor, which plays a role in stability of synovial joints, is the number and positioning of ligaments. So ligaments, basically, they prevent excessive or undesirable movement. And the more ligaments you have, the stronger is the joint. And when the other factors of stability are lacking, the ligament can actually stretch, and this allows the joint to become more unstable, which is a bad thing, obviously. Okay, so now we're going to talk about the most important factor, which is muscle tone. So usually skeletal muscle especially. So let's say this is the tendon, and this is the skeletal muscle, and this is the tendon. Usually the skeletal muscle has some muscle tone, which basically means that it's under some low level of contraction, and this causes the tendon to be under tension. That means the tendon is under tension, not lax. Okay. So these tendons that cause the joint play a very, very important role in stability of the joint. So for example, here we would have the quadriceps muscle, and then its tendon attaches here. So the tendon of the quadriceps, it actually spans the knee joint, and so the muscle tone in the quadriceps causes the tendon to be under tension, and this is a very important factor in stability of synovial joints. So this is one example. And then another example of this is the shoulder joint. Okay, so now let's talk about the 6 types of synovial joints. The 6 types are based on the design, and based on design, they are going to permit the degree of movement. So we have plane joint, hinge joint, pivot joint, condylar joint, saddle joint, and ball and socket joint. Okay, so the first type, we have the plane joint. So the action of plane joints, so the action permitted by plane joints is a gliding movement. Basically what you see here. It's non-axial movement. So all the movement occurs in this plane, okay? Like on the horizontal plane. So it's they call it non-axial movement. And then an example of this is the intercarpal joints. So right here we have the carpals, and then the joints between them is the intercarpal joint. So that's an example of a plane joint, and they allow gliding movement. Another example would be the intertarsal joints. So the second type of joint is the hinge joint. Examples of the hinge joint include the elbow joint and the knee joint. And basically the action that the hinge joints allow is flexion and extension. And then it would be uniaxial movement because you only have one axis. The movement occurs along a single axis, in this case medial and lateral axis. So the axis is here, the axis is here, and then you would have flexion and extension. Okay, so this type of joint is called the pivot joint. The movement allowed at a pivot joint is rotation, and it's again uniaxial movement because you only have one axis. You have in this case a vertical axis, and for example, an example of this would be the proximal radio-ulnar joint. So this is the ulnar, this is the radius, and then this joint here is the proximal radio-ulnar joint, and there is rotation of the radius. The radius can actually rotate. And then another example is the atlantoaxial joint. So right here we have C2 or the axis, and here we have atlas or C1, and the joint connecting them is the atlantoaxial joint, and this joint permits rotation of the head. So we call this joint where rotation occurs a pivot joint. Okay, so the next type is the condylar joint. It allows a biaxial movement because here we have two axes. We have medial and lateral axis, and we have a movement that occurs along anterior and posterior axis. So we have the movements that can occur are flexion and extension, and adduction and abduction. So it's biaxial movement because the movements can occur along two axes. Okay, and then an example of a condylar joint is the metacarpophalangeal joint or the knuckle joint. So here would be your metacarpals, and then here would be your phalanges. So we call this joint here the metacarpophalangeal joint. So the metacarpophalangeal joint is an example of a condylar joint, and then the movements allowed again are flexion, extension, adduction, and abduction. Okay, the next type of joint is the saddle joint. Again, it's biaxial movement because you have two axes. You have this axis here, the medial lateral axis, and you have the anterior posterior axis. And the movements allowed are adduction, abduction, flexion, and extension. So whenever you have biaxial movement, you're going to have flexion, extension, abduction, adduction, just like in the previous joint, which was the condylar joint. So example of saddle joint would be the metacarpal joints of the thumbs. So here we have the carpals, and then this is the metacarpal of the thumb. These are the proximal and distal phalanges of the thumb. So this joint here is the metacarpal joint of the thumb, and it is a saddle joint. Okay, the last type is ball and socket joint. This is the only joint. This is the only type of joint with multi-axial movement. So you have axis here, medial and lateral axis, anterior posterior axis, and a vertical axis. So because you have more than two axes, we call it multi-axial. It allows multi-axial movement, and it includes flexion, extension, abduction, adduction, and rotation. So we call it ball and socket joint because basically you have like a ball, like for example the head of the humerus, articulating with a socket, like the glenoid fossa. Another example would be the hip joint. The hip joint, like I mentioned earlier when we were talking about factors that play the role in stability of synovial joints, is a ball and socket joint because the head of the femur fits into the acetabulum. Okay, so let's talk about some accessory or related structures of synovial joints. We have in the hip and the knee joints something called cushioning fatty pads. They basically act as a cushion at the joint, just from the name. And then we have something called articular discs or menisci. They are found at the knee joint. They're basically fibrocartilage. So these are the menisci, right here and right here. They're basically fibrocartilage that separate the articular surfaces. So this is the tibia, and over here you would have the femur. This is the distal end of the femur, and this is the proximal end of the tibia. And so this is the knee joint, obviously. And then you have these menisci, which are fibrocartilage. They separate the articular surfaces. So here would be the articular surface of the femur, and here's the articular surface of the tibia. So they separate them. And they divide the joint cavity. So the joint cavity is here. The menisci divide the joint cavity this way. So you have this side and this side. And finally, they make the bones fit properly together. That's the function of the menisci. They allow proper articulation of the bones. Okay, we have some other related structures like the bursa, which we talked about before. It's basically a fluid-filled sac lined by synovial membrane, which produces synovial fluid. And they lessen friction between different structures like ligaments, tendons, bones when there is joint activity. Okay, so the final structure we're going to talk about that's related to synovial joints is the tendon sheaths, which we also talked about before. It's basically an elongated form of a bursa. It wraps around the tendons. So these white things here are the tendons, which attach to muscle. And then you can see in blue are the tendon sheaths. So they wrap around the tendons and protect the tendons, and they're common around the wrists, like right here. Okay, you can use this as a reference, and we'll just quickly review the articular system. So structural classification, there are three types when we talk about the material of the joint. There is fibrous joints, cartilaginous joints, and synovial joints. So for fibrous joints, there are three types. We have sutures, which are immobile, so synarthrosis. We have syndesmosis, which are bones connected by ligaments. They can be slightly movable or immovable. Slightly movable would be like the interosseous membrane connecting the radius and ulna, and immovable would be the distal tibiofibular joint. If you remember that short ligament that attaches the tibia and the fibula. And then we have gymphosis, which is articulation of the teeth with the alveolar process by the periodontal ligament. It's also immobile. And then cartilaginous joints, we have two types. We have the synchondrosis, which is the bones connected by hyaline cartilage, like the epiphyseal plate or the growth plate, and the costochondral joints, which connect the ribs to the sternum, and they are immobile. And then we have symphyses, which is the fibrocartilage, like the intervertebral discs or the pubic symphysis. They are slightly movable. And finally, we have the synovial joints, which are characterized by a joint cavity. There are six types: the plane joint, the hinge joint, the pivot joint, the condylar joint, the saddle joint, and the ball and socket joint. And of course, they are freely movable, and then the degree of movement occurs is based on the design of the joint.